What's the correct worded verbiage?
I'll second.
Motion to start? Is that what it is? Motion to start.
All right, and I heard a second.
I'll second. Yep.
Awesome. We have a proper motion before us. Is there any discussion before the clerk calls the roll? We already called the roll. I think we can say that motion to begin the meeting passes. All right. Before I open the hearing to public comments, let me summarize the process for conducting the public hearing in this online format. First, we will be taking speakers in the order that they pre-registered, if any. Speakers will be limited to 2 minutes. We ask that after your name is called, that you state your name and address for the record, and then proceed to your comments. After we've completed the list of any pre-registered speakers, we will see if there are any speakers in the queue who may have called in. In order to activate your microphones, you'll need to press #6 on your phone. With that, I'll ask the clerk to identify the first speaker in the queue, if there are any.
We do not have any public comments for this evening or speakers.
All right. I would say then we can proceed with the agenda. All right. So do I have a motion to accept the minutes from September 14th meeting, Animal Care and Control Advisory Board?
Motion to accept the minutes.
I'll second.
All right. All in favor?
Aye.
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 All right. Motion passes. All right. So moving down the agenda, we now have the agenda item for discussion. We have one agenda item called Adoption Initiative.
Yes, Caroline, what did you have? You asked for this to be on the agenda? You're on mute still.
Okay. You know what? I'm not prepared. I hate to admit it, but I wanted you to talk about the December adoption initiative.
Oh, okay. So as most of you probably know, for the month of December, it was decided that we would waive all adoption fees for all animals, dog, cat, critter, as well as all rescue transfer pull fees for any animal that needed rescue placement or that a rescue chose to take. Even if they were an adoption floor candidate, it would be a waived fee. That's been going very, very well. We can hardly keep an animal on the adoption site. We get appointment requests very quickly. The hardest part is occasionally no-shows on appointments, and the occasional people choose not to, which is a good thing if they decide it's not a good fit. But cats, we have 4 in the whole building at the moment, or something like that, 4 to 6, because anything that's adoptable has been flying out the door, and then we've been, again, kind of managing our intake with the resurge of COVID, trying to maintain a lower population, not knowing what could come in with owners being sick, that kind of stuff. Along that line, we also, about adoptions, we put up our first FIV positive cat for adoption. And it was already adopted. It was a senior girl who had other than being senior, had no health concerns. And we ran blood work and just did the FELFIV because we ran blood work, and she was an indoor cat and she happened to be positive, but put her up with a write-up, and she had an adoption appointment within a day or two and has been adopted and gone home. So all good there. So that's an exciting another first for us. We've been doing more meet and greets with owned animals to dogs for potential adopters and things to see how, make sure it's a decent fit before being adopted. And that has definitely helped ease some people make the decision to adopt. We did have one, not in December, but that I assisted with, that made the decision not to adopt because it was not a good fit with their dog, or it didn't seem to be, and it was definitely going to be more work to acclimate the dogs to each other than other fits might be. So overall, I think adoption stuff has gone really well. For us, I think by appointment has given us the ability to really counsel people better and spend more time with them. We've been booking cat adoption appointments for 45 minutes and dogs for an hour. And we are able then to spend more time talking to them, giving them more information, answering their questions. We know who they're coming in to look at. Doesn't always mean they leave with that one, but because of the way we're booking them, most people have to kind of say, this is the one I'm really interested in, and kind of make that decision ahead of time. Just because we have so many people wanting to adopt right now, especially with the waived fees. But we are able to get folks in, and we've had a few that we had others available, and they've counseled them and gone, you know what, meet this one, and they end up picking the other one because that was a better fit for them. So we really are able to take more time and spend more time. So I think the customer service level has increased because of the adoption appointments, as well as just the focus on trying to do more adoptions right now. So I think that's all been going really, really well. Does anyone have any questions on anything with that while we're on the topic?
Don't have a question, but I do have a request. If you guys are comfortable with it, for Friends of Mac, I would love to do a follow-up on the FIV cat that got adopted out and announce that that was a first for the shelter, with, like, I don't know, some kind of follow-up of, yay, it's in its home and it's happy and it's healthy and all that jazz, if the adopter would be willing to do
Yeah,
that.
if you send me an email, Megan, I would be happy to reach out and talk to the gals at the front and see if they know more.
Okay.
And get contact with them.
Okay, cool.
And
I think
Heather, what was your question? Sorry.
I was just going to say, I think the community would love to know that. And I know Mac is already getting props within the rescue community for not euthanizing FELV and FIV, which a lot of shelters are still doing. But I'd love it if the greater community knew that too. So.
Perfect.
What's the possibility that you guys will be able to continue the adoption program, not the waived fees, but the appointments and the counseling once we are out of COVID?
So Mac we'll talk about budget in just a little bit, but I do believe that your managed intake and controlling the flow in the shelter is probably going to far exceed COVID, honestly, partly because of our staffing issues that we're going to encounter in 2021 through probably 2023. So, but we'll talk about that when we talk about budget. So yes, there's a big possibility.
Thank you.
Okay.
We are loving appointments. A lot of staff really, really like appointments, even not just for adoptions, for anything. We don't have a random person walking in and starting to yell at us because we have their dog and we're trying to help them what they need and or whatever. Like it's much more controlled. We're also able to vet people ahead of time on what they're interested for adoption, when they're coming to get their dog, what do we need? You know, make sure they walk in with a rabies certificate so they don't have to pay for us to do it. And we're not trying to call the vet and things like that. So appointments have been great, a great byproduct of this. And it's something that we definitely want to work into the future for us. It might not be everything appointment, but definitely something that we want to continue doing because it has really been beneficial and much more customer service friendly. Anything else? Anyone else question, comment on adoption stuff?
It's also been a lot safer, not just for my staff, but for community and the animals, because prior to this, people were just sort of wandering around the shelter willy-nilly, and we've had people get their hands bit and all kinds of just crazy. And it's usually not the animal's fault, but you know, once they bite, we kind of in a pickle. So I think it's overall just a safer, with the limited staff that we do have, it's just safer for everybody. Sorry, I had to throw that out there.
That's great. Thanks for that update. That's sounds really good, and I'm very glad that everything is going well, and awesome that you can find good silver linings from all of this disruption too. So that's awesome. The next agenda item was a presentation, Parks for All. Danielle or Caroline, is that something you can walk us through?
Danny, did you create a hyperlink for that, or was that?
There is a link in the agenda that was sent out. I also sent it out with an email Carolina resent it to you today that has the letter from the park board to our board,
She knows me
as
well.
as well as the presentation that they have made for this, and they are asking for our board's feedback on this presentation and initiative that they're doing. I don't think we need to go through the whole presentation in our meeting, but if you guys are able to look it over and supply the feedback they requested, it would be greatly appreciated as another board to assist them in their future.
Yeah, so can you hear me? Hold on a minute, I lost you guys.
Yes, we can hear you.
Yep.
So maybe we should just file it, that you received it and filed it, rather than go completely through it, because I think it may take a while to do that. But yeah, they're just looking for feedback from other boards on their park initiative that they're doing. For
Did they send this to all of the advisory boards, or just a few that made us?
I'm assuming all of the advisory boards, but MAC does work pretty closely with the park board because of dog parks. So I'm sure that part is in there too, and that's one of the reasons they're reaching out to you guys.
And I think it said in the
Yes,
letter,
Heather, the large 84-page document is their presentation to view.
I'm just opening up their letter to see when they wanted feedback by.
Perfect. Heather, what's your question?
I'm not. I am off mute. So I was just going to say they've got a community virtual open house hours through January. Do we need to put on the agenda for our next meeting to review and get back to them, or do we need it's got a 70-day public, looks like we have to get back to them before January 18th.
Yes.
Can we get a
instructions? Yeah, sorry, what?
I was just wondering if we need to schedule another meeting then.
I think it's probably something you could do through email if you want, and then draft something together. What do you think, Danny? Or you can have a meeting, whatever you guys want.
Yeah, or we can definitely set a meeting and go through this a little more. And I mean, I think it'd be helpful if we all went through it separately, to get an idea in case we have questions, and then I can always reach out to Park Board and get answers. From what my brief view of it was, since they were looking for board members' feedback, not my feedback per se, it seemed like they were just looking for feedback and they had a way to submit that. And to me, it didn't necessarily sound like it had to be from the board specifically, as much as
from the
board members that are, working with other boards to do feedback. And in most cases, we're one of the few that doesn't have to be a resident, but that kind of thing. But yeah, you guys can let me know after viewing it if you want some additional info.
Yeah, and it seems like they probably have, they're sourcing feedback from a lot of different places. And so I think it's great that they are giving us this opportunity, but it doesn't seem like it's something that we all need to necessarily, publish anything. We're not giving them any formal, agreed upon feedback. It's sort of just,
Yeah, it looks like either do the survey or go to one of the community virtual open houses.
Yeah, I would
formal
think
comment letter or an email through the president. Yeah,
they're looking for people who are representatives of the community in which they serve. You are, whether you live in Minneapolis or not, you're representing the animal people, in Minneapolis and helping with the shelter and that sort of stuff. So I think it's still important, whether you lived here or not, as a board member, if you can provide your feedback, I think they would greatly appreciate it. So.
Yeah. And then I guess question for you, Caroline and Danielle, as we go through these probably individually. And if there's anything that, I don't know, strikes us as good information that maybe we could bring back to you, would you guys be interested in hearing
Sure.
ideas? I don't know what it could be at this point, but it just seems like they've done a good job of pulling together a lot of community ideas and on how to serve through the parks. So
I definitely think there is room for some potential partnership in the future with the way we want to move with community initiatives, and parks are a great community place that, you know, events can be held at, vaccine clinics, different things like that. So I definitely think that if you pick things up while you're looking through this, it would be helpful for us to kind of go, oh, hey, they're doing this. Let's tie it in with now what we want to move to do. So definitely.
awesome. Cool. Any other comments or questions on this section? Or I mean, on this part of the agenda? All right. The next item on the agenda is new business, and we have one labeled 2021 MAC budget.
That would be me. I want to just give you an update. 2020 budget was really scary. 2021 budget was also kind of scary, and that's been my really where I've been mostly focused since COVID, honestly, is trying to protect the staff that I have and protect the budget that I have. Often in times of crisis like this, cities and counties and governments find it very easy to take money from the animal people, right? It's hard when you have a community that can hardly feed itself because they're out of work and they're in really trying times to go, well, we're gonna give $3 million to MAC so that they can keep the animal shelter running. And my job at this point was to completely focus on this so that I made sure that the community was behind us and that our city council members and our mayor and the people who were really holding our purse strings understood the importance of pets and what pets do for families and for communities and why we are important enough to continue to fund. As you know, in the state of Minnesota, animal control is not mandated. They could have easily shut our doors, but they didn't. So here's the good news. The good news is that I think I did okay. We did lose temporarily 2 positions. One of them is the front counter position. Lauren Parker has moved back to Indiana, I believe. Is that right? She left her position. We did not refill that position. And Connie Bork, who retired right before COVID hit, that position has been continuously held and it still is not going to be filled. But we saved all the other positions. So that's huge, right? When other departments were losing hundreds of positions, MAC only lost positions that where people voluntarily left. So that's a really good thing. And we did manage, we've lost some money. About 6% of our budget was taken, which included those positions and some money here and there. But the really, really interesting news, and I want to talk to you guys tonight about a program that we coined. Danny, you're going to die when you hear this. I was looking back at my emails. We coined the name right before COVID hit, was when I started sending that stuff to you. But MAC's been doing this. We've been working with domestic violence cases for a long time. I know a lot of you probably have heard of that. A lot of people may or may not know that MAC also helps people who are in medical emergencies. Like you have a heart attack and you have your dogs at home and the ambulance comes to take you to the hospital and there's nobody there to care for your animals. They will call animal control. And we pick the animals up and put them in protective services. We don't charge for those services when that happens. We also help people who have I can think of, we had a bunch of exotic birds a couple years ago where there was a house fire, and we had those birds for a long time. One of them had lung damage from the incident, and it was not uncommon to see Nico, one of our kennel techs, running up and down the hallway with this bird to get his wings flapping. It was kind of comical, but we cared for those for a couple of months until this guy could find proper housing for himself and his family and his pets, so they didn't have to give them up. These are programs Mac's been doing for a really long time, and we don't advertise it a lot because we weren't funded. We have never been funded for that. It was literally us scraping pennies together to make that happen because it was the right thing to do. That's one of the programs that we've been promoting a lot with City Council. And as we move from, we're still enforcement, we're still protection, animal protection and control, and the field is still doing their job of enforcing. Because we learned in April when our bites went up 160%, that when we're not out there enforcing our leash laws and things like that, people start getting seriously hurt. But there's another side to animal control I think that's really important that's been missed for a really long time, and that's the social service aspect of MAC. So we started putting it in writing, Danny and I, and this has been a real focus of ours all summer. And really nailing down this program. We're still working on it. And Philip Cunningham came to me during the budget markup and said, I really want to help you with your domestic violence program, because that's the only one people have really picked up on. And I promoted this other program to him, and we renamed it the Animal Safety Net program. And I want to show a presentation to you guys. It's really quick because I created it really quick, but I want to show you a quick presentation on this program so that you kind of understand where we're going. Let me just get myself together here. I had it together and then I lost it. Okay, where'd it go? Okay, so I'm going to share my screen with you, maybe. Okay. Danny. Okay, there you go.
Yeah, share your screen, pick the
got you.
presentation. All right.
Okay. All right. Can you see it?
Yes.
Yes.
So we named it the Animal Safety Net Program, or ASN for short. And what it is, it supports families in need with emergency sheltering for their pets while they find housing to get away from abusers and undergo emergency medical care through innovative programs. It also helps keep just pets and families together. So we have the domestic violence program that falls into that, the emergency sheltering for pets whose parents experience medical emergencies, which we talked about, emergency sheltering for unexpected housing displacement due to disasters such as fire, weekly low-cost vaccine and microchip clinics. You wouldn't think of that as something that keeps families together, but it's important that we continuously promote opportunities for people who are less fortunate, or I don't really care when it comes to rabies and stuff like that, that whatever it takes to help you live safely with your family. We've been doing weekly low-cost vaccine and microchip clinics through most of the pandemic. And they've been hugely successful to the point where we actually had to stop making appointments through the holidays because we were booked out through December and it got out of hand. But we'll start back up here shortly, probably, right, Annie? Staff have cried a little bit over that because it's kept them busy. Foster programs for extended care of displaced owned animals. This year was the first year that MAC has ever had an official foster program. We're still fleshing that out a little bit, but we have had animals now go. Matter of fact, I have 2 dogs. Is the male dog in foster care, or is he still at the shelter?
He's in foster care with a volunteer.
Well, same thing. So we have 2 dogs that are in foster care right now for long term. Their owner is a veteran who is having severe medical issues, mental health issues, and I think physical too. We expect to actually house these animals for 6 months. So that's a good example. Critical care assistant grant-based funding utilized to assist low-income individuals with emergency care for their pets. That's another part of the program that we're working on. Field assistant program, a resource an officer can use to utilize in the field for instances where unintended neglect has occurred because of income barriers or other reasons, but for which the animal has experienced limited suffering, and the issue can be easily remedied through humane education and moderate assistance rather than direct and immediate enforcement. It may be medical advice from our own veterinarians, grooming by our ACTs, which we've done quite a few of those cases because COVID, people couldn't get out to get their animals groomed and it was getting ugly. And on occasions, medical examinations and prescriptions for medication, we've done that. Officers may also make referrals to other programs to assist the owner in finding solutions and resolutions to issues. So it's bringing the field into it as well. We're super excited about this program. And what I was saying earlier is it started unofficially in the division. It's been helping the community for years. We've been doing this. We've never charged for kennel fees. Minor, I would imagine I know since I've been here, we've done some major medical. This one of the dogs that we're housing right now was pregnant, really pregnant when we first got her. And she had 13 or 14 puppies and 3 got stuck in the birth canal and almost killed her. And she went through emergency surgery to save her life. And that would have cost him $4,000 or $5,000 probably in the real world. And Mac did it. So, and saved her life. And this dog's been with this guy for 8 years. She is his rock. So this is cool, right? What's changed? And I told you about that this year, thanks to the efforts of City Council member Philip Cunningham and Lisa Goodman. I don't know if I mentioned her earlier. They partnered together, and Mac was recognized for the incredible work performed by the division. Through unanimous consensus, the City Council voted to grant $280,000 to Mac's budget, specifically earmarked to promote, develop, and implement the ASN pilot program, thus beginning the process of making this program official. So we're super excited about this. It kind of, Danny and I are really literally fell over backwards. You could have knocked us over with a feather because we were thinking 5,000, you know. But he managed to get $280,000 for us. So what transition does MAC need to make to ensure the success of the program? We need to further develop the emergency foster program, expand our community outreach, engage neighborhood associations, hire 1 to 2 positions to spearhead this program because we're trying, but we struggle, and engage the board to embrace the program and help us make it a success. Why is it important? Because studies show that pets help us to be healthy, both mentally and physically, and are an important part of our society. This is the next step to Minneapolis becoming and continuing to be no kill, and it recognizes the importance of animals and pets as important members of family units, recognizing that the first step to ending the unnecessary killing of animals in our society is to help keep families together in times of need, and allows MAC to develop trusting relationships with the community we serve, which will in turn help us further protect the animals from neglect and cruelty through education, intervention, and when necessary, enforcement. People will come to us if they trust us about the really bad stuff that's going on with animals so that we can step in and help them. And who do we serve? We serve everybody. From birds to, we've had fish, I remember fish, and mice and rabbits and cats and dogs, you name it, we don't turn it away. Oops, now you're catching on where I didn't delete stuff. But so that was that's the end of it. But I wanted to just share that with you because we're super, super excited about it. And I think the board is going to play a huge role in this. Matter of fact, oh, there's the puppies. I haven't been able to come to work. Everybody's quarantined right now. Oh my God, they've gotten cute. And of the 14 or 13, only 3 survived. They had
we had 13 total,
something.
unfortunately, and only 3 made it. But they just came in for their checkups last Tuesday, and they're 6 weeks old now and ridiculously adorable.
And the agreement was he's going to let us have the puppies. So he was not an intentional breeding, but anyways, and she's now sterilized because, you know, Mac doesn't just do C-sections. We take everything. But, and the really cool thing about this is he is a homeless veteran, currently homeless, but he's been known in the VA for a really long time. And they know him with this dog, Josie. And the VA is working to get him permanent housing. And his dog. So I'm super, super excited about that. And he's a really nice fella. I don't know what's going on with him. It's HIPAA related, but we've talked to him several times, and he's really sounds fairly lucid to us and really just very concerned about his dogs. He calls to check in all the time, and just a really nice older gentleman. So, and these dogs were really super well mannered, really. So they've been loved, and they came in fat and sassy. So it wasn't like they were out there being neglected on the street or anything like that. But yeah, super cool. Those puppies are adorable, Danny. You just made my day. Anyway, so do I have any questions? They're hound. They look like she looks like a black and tan hound, and we think Daddy is the little Doberman mix that came in with her.
He's not little.
He's not little. He's a
No.
big boy with a big
He's like-
personality.
Oh, I see. You typed it in there, Danny. So what do you guys think?
Love it.
The program sounds awesome. Yeah.
Yeah, and Danny and I are working on figuring out, because it is going to require, it allows us to hire a position for that. It is a temporary position, maybe two, to help us really do more community outreach and spearhead the foster program, things that Danny's been trying to juggle by herself. As in 2021, Camille, our supervisor for the vet, sorry, I thought a dog was throwing up. It's just Gracie cleaning herself. Anyways, our supervisor for the shelter is retiring, and she's not going to be replaced. Danny and I probably will be the two that absorb the shelter supervision. The vet position may be replaced, but I want a vet to do vet work. The goal is eventually we'll have a shelter supervisor. But really, Danny and I have been running that all summer mostly. And we realize we can do that, but Danny can't take on any more. She'll kill me or herself. So that's off the record. Not literally, but
Still recording. Heather,
yeah.
your question, how is the foster program going to work? In what way? What do you mean? Can you expound?
Yeah, how are you gonna vet foster homes? How are you gonna assign out animals? How are you gonna advertise to get the foster homes?
So we
already
did.
have.
Yeah. So back in March, when we didn't know if we were going to be inundated with a bunch of animals because of COVID, we did put out an emergency foster application. It's still on our website. We have not had to utilize all but a handful. I've only reached out to a few people on that list, on top of the few volunteers I already had that fostered. But our goal is to start moving more animals more regularly into foster, as just a general practice, as well as like the dogs that we have now and other safety net type animals that are typically more long term than should be in the shelter doing that. So we've got the application. A lot of it, the way I've been doing it and the way I'm hoping it'll move forward again once I get more help on that, will be, reviewing them, contacting the people, reaching out. It's really, a lot of it is conversation based for me, of like, what are you comfortable with? Here's what I have. Here's what you said you'd be willing to do, but is that really feasible in your home? Like, we had someone really interested in mama and babies until we really talked to them about what that was all going to entail. It sounded great to have puppies. And then they were like, oh, okay, I don't know about that, because they wanted their dog to play with it. Like, your 4-year-old dog can't play with 3-week-old puppies. That's just not going to work. Like, this is the thing. So a lot of it's conversation. Right now, we do not background check our fosters beyond what we do, just with anybody, but not like we do with the volunteers in-house. So, some of it's still being fleshed out, but we do have some policy procedure in general kind of laid out to start with. And then a lot of it, I think, will be kind of adjusting as we go. Does that kind of answer it, Heather?
And we've reached out to other organizations around the country that are doing similar programs already, and to kind of get their policies and procedures around this stuff. We have a whole ton of stuff written. Some of it's written directly from, we wrote it, and some of it we copied, but it's I think we got a pretty good handle on it. And And, for me, I've learned so much in the last couple of years about like weekend getaways, take me home for the holidays. They wouldn't let me say that. I don't know did they actually finally say that in the advertisement for this thing, this adoption, Danny? They wouldn't, I wanted to advertise this, take me home for the holidays. They wouldn't let me. They were scared of blowback. But, it's okay that an animal goes home for a couple of days with somebody and they bring them back because the animal has an opportunity to decompress and we learn more about the animal, and it's okay. And it
Well, and
took us a while to
Caroline,
get to that point.
there's also research to support what you're saying as well.
Oh,
Like there's literally scientific evidence available in a quick Google search to support that as well. So absolutely.
yeah, it's okay. And Mac didn't always feel that way. It wasn't that long ago that if you brought an animal back, you could not readopt from us. Staff thought it was just horrific. What are we doing to the animals? You're confused, and that's just not true. So, we're changing, we're growing. It doesn't mean that we were wrong and horrible people in the past. It just means that, we've learned more and times have changed and we're trying to change and grow with those changes and just get better at what we do. And I think we're doing pretty good.
All right, Chris
So.
had a two-part question here.
I do. And maybe, Caroline, what you talked about with the shelter manager and whatever may happen from the veterinarian perspective, maybe this is moot, but given the fact that you've already lost 2 positions and now you're looking to add 2 positions, how likely is that and how much of a strain may it put on the organization? But the second piece of that, and this foster program may make this a moot concern, but part of our review this year and more so last year, one concern that was raised, which I still think it's a significant concern, but is the fact that essentially all of your animal enrichment is only solely on the volunteer shoulders. So that was kind of another need. We felt like, so just a concern that I feel like a focus needs to be there. But the foster program may make that moot. I'm not sure.
Yeah, that's a legitimate concern, but that's not exactly true anymore, Chris, because our staff have direction that every animal gets out every day. So staff are doing a lot of the care that way now. And with us, and I'll tell you how we're able to do that, because the reality is with, what we got, 4 or 5 kennel techs that work 7 days a week. Our capacity is way below what the shelter capacity actually is. And by doing managed intake, where we're, rather than just, somebody says, hey, I want to get rid of my dog, the officer goes out and says, what's the barrier to keeping your dog? What's going on? How can we help you? And a lot of times it's a resource issue, a temporary resource issue, or, really the best person to rehome their animal is them. So we're really only housing animals that most of the time that really need to be in our shelter system. And it's lowering the intake numbers, which is giving staff more time rather than running around cleaning constantly. They have more time to actually spend with each individual animal. And the city's recognizing that. Now, as far as hiring 2 people, the reality is the $280,000 was earmarked specifically for that. I can't hire a kennel tech or an officer in that position. But it still will take off. It still will help the work that they're doing, because right now the animal care technicians and admin people and, all the different positions that I have, they're all, all these appointments that we're making and all these adoptions that are going on in the foster program and the different things, we're absorbing that with less people. So I think we'll actually be in better shape.
So a follow-up question, maybe it's not ready for prime time yet, but this presentation, if and whenever it's for public consumption, is it something that can be shared with us just so that we can be better educated on it and be advocates for it?
I'll flush it out a little bit more. This was a quick presentation that I had to put together, and I'll flesh it out, whatever, more for you guys, and I'll email it out.
But Chris, just to add on to Caroline, I do think that with hopefully moving into more foster, and not just for our animal safety net animals, but animals in the shelter, I do think that we will get even more time to focus on enrichment in-house, and our staff has been doing a good job of coming up with not just taking them out, which was not used to be an expectation that was solely on volunteers to take them outside, the dogs outside every day, and doing those different things. Are definitely, COVID has given us a chance to reevaluate that, and because we went to so low numbers, we were able to kind of change how we were doing. I mean, we didn't have volunteers for a while, so it was all on us, and it kind of made us go, well, this is what we need to prioritize and do, and we can make it happen if we do these things and whatever. So I do think that is getting better. There's still definitely work to be done, for sure.
Yeah. If we can talk off the record, Danny, can you stop that record?
Yep.
Let me know.
Oh, no, I can't. We can't stop a meeting
report?
in midst. We have to connect later.
Okay. We'll talk off record, but it's been a challenge because it's a change, right? But it's working, and the goal that I'm learning about on a national level when we talk about this animal human social services is not just MAC. This is a national movement, and the goal is that 80 to 90% of the animals that come into the sheltering system go immediately into foster homes and are adopted from their foster home. So in a way, they're kind of looking at a sort of a rescue. They're kind of combining rescue and sheltering. And so that only the animals that really desperately need medical intervention or behavioral intervention are in the shelter being cared for, or is truly vicious or dangerous, that kind of thing. So, Megan, did you have a question?
I don't have a question. I was going to say, speaking from a volunteer perspective and what I've seen from the shelter over the last 9 months and the changes that have occurred, I've definitely seen a lot more, as Danny and Caroline mentioned, just involvement from staff and kind of the day-to-day enrichment kind of thing. So I know, like, one kennel tech has been very active about trying to teach dogs 4 on the floor, get you what you want. So instead of jumping around like a hot mess in their kennel, they learn that when they're calm and they have 4 paws on the floor, then they get what they want, which is a treat or attention or whatever. And I had never heard anybody say anything about that in the years prior. So I think there's definitely been more attention to behavior and enrichment, because as I said, I'm also seeing techs out in the runs all the time with dogs, which is great. To your point though, Chris, I think pipe dreams, like someday it would still be awesome to get an enrichment coordinator who is literally doing play groups all day, or,
Oh yeah,
training cats to reach out of their bars of their kennels so they look cute, or all that crap that we see on YouTube. Like, I think that would still be really great. But I will say, from a volunteer perspective, I've seen a huge shift in what staff has the capacity to do now, and it's been really awesome.
Great.
Yeah, and it's more than capacity, it's buy-in, right? We're not just a punitive organization anymore. And it's not always been easy. We've got a field that's more enforcement, right, minded, and now I have a shelter that their job is to save lives. That's their primary mission, is to save lives. And our goal is that 100% we never meet this, actually, because there are some that we just have to do what we have to do. But our goal is that every single animal that comes in the shelter is rehabilitated and a new home is found for them if needed. And it doesn't mean that we're not euthanizing animals that need to be humanely euthanized or have significant behavioral issues that just are too dangerous. But I mean, we've had dogs that a year ago, had they come into our shelter, would have died in that shelter because they just wouldn't have passed a behavior test. And they're turning them around. I know Megan has helped with several, and helped blow even our minds with some of them. So it's been really rewarding, and staff are really completely buying into it. But it's still challenging. It's hard sometimes to put the two together, but I think we're doing that, and it's getting more and more successful. Recognizing that there's 2 different missions, and the Animal Safety Net program brings the field into this. It's not just the shelter doing it anymore, it's the field. And officers have brought, one I remember a lot of was Sierra, who brought this little matted up, nasty looking dog. And it was from a little old lady who'd had the dog for, I don't know how long, 3, 4, 5 months. and couldn't get out. She couldn't get out of the house to get the dog to the groomer, and there wasn't a groomer open because of COVID, and the dog was just nasty. And she contacted us when we first started this unofficially and said, "Can we help?" And I'm like, "Yeah, bring him in." And so he got a medical exam, right? And this is the one that I think made us decide we need to start doing rabies too and other vaccines, because we realized nobody could get into the vet either. And we have some people that do grooming. They're groomers as well. And the dog was groomed, and she went home with groomed and all her vaccines and up to date, and a sweater, I think. But it was really cute. She wasn't being, it was neglect because of the condition the dog was in, but it wasn't neglect because she wanted to neglect the dog. It was neglect because there weren't any resources there for her to be able to get the dog groomed, and nothing was open. We were seeing a lot of people with expired rabies shots and stuff that wanted to be legal, and wanted to be safe with their pets, but they couldn't get an appointment for 8 months with their vet. So Mac stepped in, and I think that's the important role that shelter and our staff can play in the community, is stepping in and really helping ensure that the resources are there for those who need it, no matter what your status is, whether you're rich, poor. It doesn't matter. We're doing it for the animals, and we're doing it for society to help keep everybody safe. So
is that the primary way that the community is able to tap into this ASN, is through the field?
No.
Or
most of it hasn't come through the field.
Correct. Yeah, mostly
Okay.
we're getting it. Some of it is, but the hope is for it to be, ideally with this one-time funding, we can get additional staffing to assist with coming up with this. How does this program work? How do we, get the word out? How do we keep it funded? How do we, continue it? So that other agencies that may be in touch with these people, just like a human, social services or the domestic violence, folks that are at shelters or whatever, the homeless shelter, whatever it might be, can know to come to us. But also we want our field staff to grasp it and own it and go, okay, I'm getting called out to a surrender, and why? You need food this month? We will give you food. Keep your pet, please. You love it. It loves you. You're caring for it otherwise, whatever. Same with, like Caroline mentioned, when it's a matter of maybe they need to be educated, or they can't, they're trying, but they can't do it for whatever reason. How can we step in and assist them so we aren't citing them when they can't afford a citation and never going to pay it, and, or taking their dog or whatever the case might be, if it's something that can be rectified, and reasonable versus true neglect that we do need to step in and, remove them. So we really want it to come from everywhere. We want it to be field. We want it to be the community. We want it to be other places, bringing people to us that need that, so we can facilitate or help get them the resources they need.
And let me give you an example. The possibilities are really endless. I've already reached out a year ago to some community group, some like neighborhood group organizations. Say you have someone who just needs their fence fixed, but they can't afford to fix their fence, and their dog keeps getting out. And we keep going out there and we keep writing them tickets for, leashing violations that they can't afford to pay. And if you owe MAC money, you can't own a dog in the city. Right? So animals get seized because of this stuff. And and it's a pain. Who wants to? We have other things to do as well. I don't want to keep going out and citing someone because their dog's running loose. Their friendly dog that's not really bothering anybody, but the neighbor doesn't like the dog in his yard. So one of the ideas of this program eventually is to be able to work directly with community groups where they can go out and help the person fix their fence. Not MAC, but the community. Hey, we've got this issue, and these are nice people. Otherwise, they're taking good care of their pet, but he keeps getting out because it has rotten wood, or he's digging out and it needs X, Y, and Z just to stop that. There's a lot of opportunity here. It's just we haven't been able to do it officially because it's very limited what we could do because we just didn't have time. Now they're saying, hey, we're going to throw this money at it. See what you can do. Here's a year. And if it goes well, which I think it will, we may be able to get permanent funding for it. And there's grant opportunities as well. And I will say that some of this started because of Best Friends and the Rachel Ray grant that was granted to us in the spring for COVID relief. We started splitting that money up and earmarking it for the community. So.
Cool. Awesome. Well, yeah, I could definitely think that this has a whole lot of benefits. I'm very excited to hear more as you figure some of that out. And I think it goes without saying, but let us know, the board, know what we can do to help support it, or, help in any way. So.
Thank you.
Any other questions or comments on that before we move on? All right. Well, once again, really exciting. So hope to hear more soon. The next agenda item is max data from September to November. And I see that you've included a link to the PDF here, but does anybody, Danny, are you going to walk us through this?
Yeah, for sure, Ken. Go through I know that they wanted a standing agenda item for our numbers, which is our usual.
Danny, you're on mute.
Yeah, I just realized that. All right, let's try it again. Was I on mute the whole time? That I was? Okay. All right. So, standing agenda item that was requested was our numbers. Obviously, one of our biggest requests from the public, as well as interest of most people, is where are we at? I did calculate our live release rates. So, looking at September of this year, dogs was a 93.5% live release rate. Cats was an 87% live release rate for an overall, or just combined, of 89.6%. So close to 90, not quite 90. October, dogs was 83%, cats was 88%, so overall was 86%. And then November, dogs were 90.5%, cats were 88.8% for an overall of 89.7%. So we're hovering real close to the 90, not quite 90 on all of them.
We go through, Danny's really good at this. She goes through every one of these to figure out why are we not meeting this. And there is a reason. Danny, would you like to explain that?
Yep. So I do go through and look at, why were we euthanizing this month? What were the reasons? Was it valid? Not that it wasn't valid, but making sure that we can really relate to the general public or anybody. Why did we make the decision we made on those animals? And I know, so for September, it looks like we had a good chunk of cat euthanasias, and looking back, if I remember correctly, it was a lot of them. We were still seeing a lot of injured stray cats. We've been seeing that a lot this summer, and most of the time we have such a higher intake number for cats and things that kind of buffers that because we aren't doing as much intake, it's definitely being a bigger toll on our overall numbers when you play the numbers game that way. And I know in October, because that's when Mama came in and we had all those babies, and since some of them did not make it, that also goes against our live release rate. We had a kitten that passed last month, as well as, or in October, excuse me, as well as 3 puppies in October, because it was right at the end of the month. So that also greatly affected our live release rates on those months. And then November, I know we had a couple owner requested euthanasias, which has also been a big factor in live release rates for us going down. Even when we had more than one in some months before, again, with higher intake, we didn't have as much of an impact on our percentage. But now that we are, again, a much lower intake numbers, 1 or 2 a month is really causing our 90% to go down, or go below the 90% where we want to be. But again, we definitely feel that we are putting out all the appropriate animals and only euthanizing for the reasons that we feel are valid reasons.
Yeah, and this is a national trend. So they're trying to figure out, we're keeping a lot of animals out of the shelter now, and I consider that a live release rate as well, right? That's part of it, and we're still trying to figure out how to track that, and we're still engaging with Finding Rover, which I think has somehow gotten stuck on a back burner somewhere. This just reminded me I need to get on them. And Danny's still working with Chameleon, trying to get our lost and found stuff updated so that people can put those, like find to foster care is one that we're working on, where you find the animal and you're willing to hold on to it for the 5 days to see if an owner comes forward. We will advertise it on our website, take care of any medical emergencies or issues like that. But at the end of the 5 days, you can either adopt the animal and we'll sterilize him, or you can bring him back to the shelter and we'll sterilize him and the dog or the cat, rather than having to sit on our floor for 10 days or however long before we can get it available for adoption. It can now be immediately put up on the adoption floor, which will limit time in the shelter. So there's a lot of different things that we're trying to figure out so that we can manage our intake, still focus on the animals that really need us, and also keep track of the ones that we keep out of the facility because of managed intake, because that's really part of your live release now. And it's a problem all over the country. But I will say that when we talk about cats that were injured, we're not talking about just a simple broken leg. These are really, like, they were on death's door and an emergency vet euthanized them.
I do want to throw in, I know, I can't remember which month we had the cat with tularemia. And that was a big...
That was a crazy month.
That was a crazy month. That a bunch of staff were exposed to, and it is a zoonotic disease that a bunch of us had to take our temp every day for 3 weeks to make sure we weren't possibly infected. And it had a housemate that was recommended to also be euthanized. I mean, so that's 2 cats out of however many. I can't remember which month it was. I think it was either October or November.
Yeah,
that we dealt with
crazy.
That was October, actually.
Danny, we were dealing with COVID. We had staff members with COVID. Then we ended up getting a ton of staff that were exposed to this. This disease can be weaponized. So Homeland Security got involved, and they were exposed to this cat. And because we have wonderful veterinarians, they recognized it, and we sent it for testing. And sure as hell, it was Tularemia. I can't even pronounce it. This stuff can kill you. It's rabbit fever is what we called it down the south. And I mean, it's ugly, and in so many ways. So anyways, luckily we were all using our PPE. Nobody got sick from it, but they were all basically, they could work, but they had to do all this stuff to work, and everybody was scared. And then I walk past the bird room one day, and it said something about tuberculosis, and I'm like, Jesus, just what we need this month. So avian tuberculosis, and that room was in isolation. So we've had but that's what we're here for, right? I mean, it's kind of neat in a way, because that is the purpose of animal control and animal sheltering in animal control world, is to deal with this stuff. And because we're managing our intake, we have the capacity to do it. We're not, it's really kind of a wonderful thing. But you're going to see the numbers go up and down sometimes. Hopefully we stay in the high 80s though.
Yep,
Didn't we have 100% on cats one?
We did 1 month had 100% on cats. Can't remember which month that was. It was this past year. And from December 1 to yesterday, we're at 91% overall.
Cool. And just being creative with our adoptions and fostering, and what is lost in care.
Literally means they were lost. So
no.
Stolen, yes, it does.
Oh.
So stolen, or in this case, this was it got away from the ACO after being impounded.
Oh.
But we have, like, if a dog ran away and we never recaptured it, that would be a lost in care number. So it doesn't happen often, but yeah, stolen or got away from us while in our care. And yeah.
Was there just one?
Yes.
Yeah, we've had some weird things happen. We had a Chihuahua that escaped out of the whole. I don't know if you've ever seen the inside of a truck, but there's a inside door, and there's a little hole. So when they have a vicious dog, they can stick a catch pole in there and put it on them before they open the door. And the little Chihuahua managed to get through that little hole and escape out of the garage through our gate. And we caught him in Boone Island. Do you remember that, Danny? I mean, it was crazy. It was a foot chase. So That's doesn't happen often, but when it does, it's usually quite exciting.
All right, any numbers? Any questions on the numbers or anything else anyone needs or wants from this section? All right, I don't know if you're ready to move on, Ben.
Yep, that sounds good. Thank you for walking us through that. Now on our agenda, we have unfinished business. And the first agenda item there is board vacancies, applications, and plan to proceed with filling them.
So we wanted to, we have, I think there's maybe 4, maybe 5 applications right now. We wanted to know if the board wanted to be part of that process, I think was the question that we had.
I think that'd be awesome.
This has been such a wonderful board. You guys work so well together. I want to keep that momentum, because whether you know it or not, and I know we didn't feel like we finished it, and we still have, like, we were calling best friends in, and that got canceled because of COVID and stuff, to come and do the shelter review. The work that you did has made such an impact on this department, and has truly changed it. And it's probably been one of the most impactful boards that I've ever had the privilege to work with. So I want to make sure that we keep that synergy. I don't know. Anyways, I want to keep it going. And I wanted to know if the board wanted to be part of that process. And if so, we will move forward with it.
Would you like us to be or need us to be, or?
I would love for you to be.
Yes, it'd be helpful.
I can do it, Chris, but I don't have a problem. I mean, but I just think that you should have a voice, and you know, and I have a feeling we may end up with some more as well.
So yeah, I think we've got the 3 positions that are open, have been posted, and then we have, like Caroline said, I think about 5-ish applications that have come through, and I know for sure at least 3 of them I thought were very good. I can't remember the other 2; they were a little earlier in, so I haven't looked at them as recently. But we can work on getting that information to you guys and how we want to proceed with that. But we really think it's great that you'd be willing to help us with that. Something definitely helpful. And then the other portion I just wanted to throw in is, like we had said before, we can't stagger our terms the way we thought we could possibly, but I've not heard back yet from downtown about whether, because these people would be coming in potentially like almost done with the end of this term, if it's by the years that you guys are going, because your guys' terms will technically be up in June, September, one of the 2. That, you know, if they start, that's like, okay, 3-4 months or whatever, and then now you have to reapply. So we're trying to find out if it's going to be 2 years from when you start. So that would stagger people by default. So we're hoping that that is a workaround to having to go through city council to change the way it was written or whatever, if this would be a way that it could be still correct in their process. So that's about all we got for that section.
So yeah, we just, yes, Chris, and to everybody, I want, you know, we held off when the 1 position became vacant because we were in the middle of this review, and it was going so well with the teams that you had that I didn't want to disrupt that with a new person coming in. And now I think, you know, with the new vaccine that's come out and stuff, I think 2021, 2022 is going to be a totally different situation than what we suffered through all through 2020. Hold on a minute. What do you need?
I was going to come in and just.
My son's screwing with me in the middle of a meeting. Kids never grow up. Anyways, so I think he was going to throw water on me, which would not have gone over well. So anyways, where was I? So they I think we're going to gear back up, and I'd like to engage the board more, and to have you be not just doing a review of the shelter, but be more part of it, right? More part of the process. I'm not sure what that looks like. I think that's for you guys to help answer. but to be part of this process to help us find the solutions. Does anybody know how to get rid of this little bottom screen that comes up when you have PowerPoints? Okay, sorry.
So, do you guys have a timeline in mind for filling those vacancies?
I think we need to as soon as possible. So I can send you, we just wanted to ask first. I think I can send applications so that you can read them. And then when's the next meeting, Danny?
That's for the adjournment. We will discuss the next meeting and schedule.
So maybe that's when we do it at the next meeting, invite them to the meeting. I don't know, whatever we think. Maybe we can do it just through email. We can talk to each other about this, perhaps.
Yeah, I think we can probably forward applications so you guys can review them. And then I think we could probably reach out to applicants. And I mean, I think we could obviously do some sort of like Teams or Skype or whatever type interview. But if you guys want to come up with, questions or, things like that we want to ask to help us pare down to 3 folks, or unless we find 3 we really like and just want to chat with them, whatever. But I think, yeah, sooner the better. I think downtown would like us to get them filled and move forward.
That sounds good. Yeah, I think that we could make that a agenda item for the next meeting. And then following that as well, did we miss considering like the roles on the board, did we miss a cycle? Or I can't really remember if 2020, maybe we didn't miss one. It just seems like this year has been really long.
Yeah, no, your guys' turn. Well, for the onboarding or whatever, to like bring a new people on to fill, because we did skip. Like it was posted and then we chose to hold off.
Yeah, no,
I believe.
I meant like the different roles within the board. So chair, secretary, things.
Someone wants to not be chair anymore.
Just hey, I
just want to make sure we're legit, right? We've usually done that at the time of a new term, so.
Okay.
No, we have not missed one.
Okay, so that's good. We haven't missed one, but I do think it's always good to rotate those roles, and so that's something that we can maybe put on, if not that next meeting as well. I guess maybe the timing would be the one after that. Sounds like.
Yes, that would be after not the first one of the year, but the next one of the year is usually when we move on to or switch over.
Okay, great. So then, I think it's just good for people to start thinking about that as well. It did, when we consider, what kind of, new board members there are, and their talents and skills. We can also consider, all of the roles that we are playing on this board now. So, and then the next item, future program planning, is that's
basically a repeat of what we talked about with budget. Honestly, the animal safety net was really what that was for, but we tied it in with budget. So
yeah, one of the things that I may reach out to the board, and it could be individuals on the board that may have more knowledge of this, but I do want to look into like foster parents. I don't know, what am I looking for? Backgrounds, how are we checking them and that kind of stuff, and policies surrounding that and what best practices are, because some of this is new to me anyways. And I think to Danny's got a little bit more experience, but I don't know if she's spearheaded it directly herself before. So it's new to us, and we want to reach out to you guys, because this is really what the board was about, was helping us develop those policies and procedures around those types of programs. And that has to do with our shelter, so that we can better serve not just our community, but the animals too. Because, God forbid, that's one of my biggest fears, is putting an animal in a bad situation, whether it be with foster parents or even rescues, because I've lived through that back in the day, and it wasn't fun, and I live with guilt forever for that, and I don't really want to relive that. So those are the kind of things that helping us move forward with this animal safety net program and other programs that we implement in the shelter to better the lives of the animals that we're serving in our community. Welcome, Adam.
Yeah,
Hey,
hi, Adam,
I'm
and
sorry.
go ahead,
Starting
Heather.
to look like a North Carolinian. Just saying. Probably 70
So
degrees.
Caroline, one of the things that we found with the Basset Rescue was the biggest red flag that we found consistently was contacting their vet.
Mhm.
And that was usually the best indicator of whether or not we had somebody who was going to be good foster home or a good adoptive home and who wasn't.
Right. So, and that's something we can talk about offline too. I mean, I don't think that has to happen in a board meeting. But yeah. So those are the kind of policies moving forward and where we want to take this next giant leap together, right? Because we took a hell of a leap in 2019 and 20, that's for sure. So Adam's right in the center of my screen. I'm looking at him like a mom.
I can't see him. Mine is only showing you.
That's because I got a big head. All right. Is there anything else?
That is all we have on our agenda. I'll ask if there's any other matters that we want to bring up in this meeting.
I do want to bring up what the board would like to work on in 2021. Does the board have any thoughts of that other than what we're throwing at you?
Go ahead,
That's
Chris.
Oh, well, does anybody have anything for Caroline?
I guess I think that the ASN is something that I think that is something that we should work on with you, and is someplace where we could be beneficial.
Yeah, I completely agree with Heather. The other thing I'd love to work on a little bit more is the community outreach and awareness of MAC and how that can play into the Minneapolis area in particular, and just the education around that. I know that the page that Megan runs does an amazing job getting some really great communications out there, but I'd love for something to go out that we can work on that is more official from MAC in some capacity.
I would second that.
I completely agree. And also coming from the viewpoint of a Friends of Mac admin, we have so many people that think we are the shelter, and so we're constantly telling them that we're not. I would love to have a social media page or a presence that we could push them to. I mean, right now we'll push them to the website and say, please reach out to Mac staff, but we're also then flooding the phone lines and whatever. If there was another source of social media that we could push them to actually get word from mouth from Mac staff or even the advisory board, that'd be awesome.
Yeah, the phone lines are a problem because we no longer dispatch ourselves.
Yes.
So
we are hearing all about it.
it's the 311 issue. So
I know.
They're doing the best they can. They're trying to hire more as well. And with COVID, 311 has been overwhelmed with calls.
Yep.
So they're trying, but it just is what it is right now. But that's something maybe we can work on with volunteers help them, or there's lots of different ways to solve that problem for MAC. And yeah,
I can tell you it is something we will need to work with city communications. That's always kind of been one of our biggest barriers for social media and any type of thing like that. But I do know that they were interested and willing to have a meeting, which obviously virtual's the best way to go, in regards to this, the whole thing of MAC having its own social media presence. How can we facilitate that? Volunteers are now kind of included in the social media policy. So there's there's some good and some bad with that, I guess, from what I understand after meeting with some of the communication folks about this last year, or probably 2019 now, I don't even remember. But so definitely, if that's something you guys are interested in, we definitely
Yeah.
want to talk to them. And
We can revisit it because I think they revamped that policy and Mac was
recently,
a big
yep.
reason why, and some other issues with city council, but Mac was a big reason why. And so I think it's probably not a bad time to revisit that. And this is an opportunity, you know, we have this pilot program that money was put aside specifically to fund. And in that, we specifically intended to hire at least one person to help that. And that person could be the person that runs that page for us too. So that's a great idea to revisit.
I would love that to be like a priority for the advisory board, getting Mac their own social media. Like I know we've been working toward that like slowly for the last like 4 years, or at least the conversations have been in works for a long time. But if they're willing to meet with us, like I would love not to drop that ball. And if we can get on a meeting and set that up, I would be all over it.
Okay. Sounds like a lot of people are all over it. You want to get with Lindsay and see if you can set something up, Danny? I'm not allowed to talk to communications anymore. They're mad at me.
Yeah. Yes, I will reach out to them and see if it's Lindsay or Jordan, because Jordan did the policy, and figure out what we need to do.
That's my girlfriend.
Oh, Gracie girl. Chris, you had a question, rescue related question.
I do, and I don't want to take too much time on this because it's probably not everybody. But I have a question about vetting at MAC, and I believe I could be wrong, but you guys are able to do dentals now, right? Probably not major dentals, but certain things you can do.
Correct.
Okay. So I just want to bring it up. So cat dentals are a significant cost to the rescues, and it prohibits us sometimes from pulling cats. I've had 3 instances lately where there has been noted like fractures of the canine tooth, but nothing's been done about it. And those typically usually have to always come out. So it's been kind of a surprise after the fact. So I just wanted to call it out and kind of make you guys aware that I lobby for, if there's a fractured tooth, you can take it out.
And sometimes the reason they're not taking it out is the vet feels like that they may break the jaw, and we don't have an ability to care for the jaw. We can't fix that. So without, this is what she's telling me, and trust me, we have major talks about this, but without an actual physical x-ray, a big x-ray, you know, of the head, not just our little dental x-ray that we have, she's not willing to take the chance. So it becomes an ethics issue for the vet, because we can't perform the aftercare. So I don't, you know, for those vets on here, you can argue with me privately, but that's been, I know there was one that I really wanted to do, and I know that was why. They thought, yeah. So we don't have ability to plate or do it, you know what I mean? So we're just not there yet. Maybe
Carolyn,
in the future.
I just want to make sure that I understand. So you have dental x-ray, but because you can't do a whole x-ray,
well, this is the one that I'm specifically talking about was a big mastiff or something that we needed a bigger, but yeah. So, you know, sometimes the jaw is in such bad shape, she's worried she's going to break it when she pulls that tooth.
Is this Camille or is this a different veterinarian?
No, this is Mary.
Okay.
So Mary's very conservative.
I'm sorry, I didn't mean to cut you off. I know for sure that's, or at least I've heard the same thing from our vets relating to dogs. I'm talking specifically cats.
Yeah, you how about coming off record with me and Danny, and we'll talk about specific cats, and then we can I can't give you a reason. Hopefully that's not, I mean, maybe you just had a run of them, but hopefully most
I do want to ask Chris, other than obviously us doing it, which would be the preference if we can, I assume there's obviously reasons in these ones that we couldn't, but was there other reasons they were like rescue only and it wasn't like notated to you as well? Is that part of?
No, I think here's what the situation was. So there have been 3 instances. One, the cat had the absorptive lesions or whatever, phorals, and so that was noted because it was rescue only. There were 2 others that one I have right here. Now I can't find it. Everest was his name. He's a big gray guy. But I'm pretty sure both of those were on the adoption floor, but had set for a long period of time. Everest was there for over 2 weeks. And actually, maybe it was because of the cracked tooth. So when we tag those, because they're not rescue only, it's not in the email, so we don't know about that, and I don't know about it until I go pick them up. I'm not about to back out after that.
Gotcha.
But so both of the two were noted to have broken canines or fractured canines, and our vet's telling me like one, once she x-rayed it, did have a pretty bad infection. The other one, I'm like, just take it out. So we're going to go to that expense anyway, but it's just dentals are a huge cost to us that really prohibit us, especially when it's so many cats need dentals that it sometimes becomes prohibitive for us to just pull cats. So anyway, we can talk about it later. I'm not complaining about it. I'm just advocating for if it's possible to pull a tooth rather than saying there's a fractured tooth and he may need a dental at some point in the future. Let's just assume he needs a dental now. So.
Yeah, some do. Sometimes we do pull the teeth. I mean, it really just depends, I think. But am I wrong, Danny? She's giving me the stink eye over somebody with stink.
That was. I'm trying to do notes and I'm looking down while I'm doing it.
Right. Sometimes
no,
we
do,
pull
but
them.
we may need to have a reminder and a chat with our veterinary team. I mean, I know we're down one, and one was the one that we lost was much more comfortable with dentals and those types of procedures than what we have currently. But we definitely, because I'm guessing, Chris, I know like when we've been calling people or talking to people about adoptive animals right now, like, they're getting that info and some are probably passing, on them because of that. But when it comes, you're exactly right. When it comes to a situation like you, where you just tag an adoptive, they're not even thinking about it. They're tagging them and printing paperwork and going, here you go, have a nice day. So
now,
something.
and we can take it offline. Like I said, I don't want to take everybody's time on this, but just know I'm advocating for that if possible.
Yeah, Chris, call me anytime. We can find out. I mean, that's no big deal. We'll find out because I really want as much of the medical as we can get done at MAC to be done, because I feel like that's part of our partnership, right? Is making sure that you're taking the really bad ones sometimes that we can't deal with, but I should try to get the moderate stuff handled so you don't have to save you money. So I think it's just a give and take. I do want to give you a status update real quick of where we are with our staffing. So MAC has, one vet that's gone. We have a part-time kennel tech that's also gone. They left together, and we had to put in a hiring waiver every time, and we're waiting on those hiring waivers. We have one officer position we're waiting on a hiring waiver for. We have one kennel tech that's pregnant and two officers that are pregnant. Danny, you don't know about one of them, so just leave it there. So one officer on military leave. So MAC is on a skeleton crew right now. We're still getting stuff done, but that's where we're at. And it's, it's kind of like we're getting used to it, but we're still moving forward with these wonderful programs. So, and we have basically one vet currently. So, two if you count Camille, but she's mostly working virtually because of COVID. So that's where we're at. But it's still amazing the work that they're doing. They're still doing how many 2 days a week? We're still doing vaccine clinics and microchip clinics and helping. I mean, it's pretty amazing. And the managed intake has made a huge difference here at MAC. So we'll catch up with you, Adam, offline. All right, that's all I have for tonight.
Any other matters? All right. Danny, can you confirm the date and time for the next meeting?
Yes, they actually wanted us to work on all of next year. So according to the schedule that we've been working off of for the last few years of the second Monday of the month in March, June, September, and December, our next meeting would fall on Monday, March 8th of 2021. So want to confirm that everyone's good with that. And then thereafter, it would be June 14th of 2021, September 13th of 2021, and December 13th of 2021 are the dates moving through that year.
Okay, works for me.
Yep. Sounds good. Thank you for that. All right. Well, I think without any other objections, I think we can declare the meeting adjourned.
Okay.
I second.
All right. Bye, guys.
All right, passes. And thanks everyone for a good meeting. And thanks for suffering through all of this formality that I am so bad at.
You're doing a really good job, Ben.
Thank you.
Okay.
But anyway.
Thanks, everyone. We'll touch base soon.
Thanks,
right.
everybody.
Thank
Have a good
you.
night.
Bye.
Yeah, thanks.
Bye.
Thank you.
All right,
Yeah.
Danny, have you stopped recording?
Not yet, and everyone has to log off, and we have to have
Oh.
no
Bye.
further discussions on this as the meeting is adjourned.
Okay. All right, I'll email the stuff to. Did you already email the stuff to Adam too? The safety net program?